want to make sure that we're able to get through this great report today. So I think we're going to go ahead and get rolling. So I'm excited to share that today's talk will be a dissemination of picking up the pieces, which is a breakthrough fall report put together by our guest speakers today and some collaborators like ourselves. So yeah, this was put together by Child Care Aware of America. Links to the report, they were sent out in the invite and on the registration page. And I'll also be including it here in a little bit in the chat and in the post-webinar messaging. So this is an exciting, slightly different iteration of ELV's 2020 breakout webinar series. You know, typically we're having folks from licensing or small business groups or ECE coaches come in and talk directly with our network providers. And I do see, actually looking at the registration and attendee list, that several of our providers did sign up and are on today. So hey, welcome to you all. I only can ever see myself during this part, but it's nice for me to imagine all your faces behind your screens. And I also see that actually the majority of our registrants and attendees are folks from ECE stakeholder organizations across Colorado and the nation. That's really wonderful to see. I think there's a lot of important information coming out today. So thank you for joining us. For those of you who aren't familiar, my name's Michael. I serve as Early Learning Ventures Outreach Manager. And for today, at least, I'm going to be your chat moderator as well. If you or your organization is unfamiliar with ELV, please feel free to reach out to me, and I'd be happy to go into detail the work we're doing beyond this data collaboration with Child Care Aware. To just ground ourselves just briefly in that other work, we're a shared services organization that focuses on supporting providers on the tech and business admin side of childcare. We run a childcare management system called Alliance Core. And I just wanted to highlight that we've implemented some pandemic-related updates to Core, including the capability of touchless sign-in and sign-out, and then also the capability of having temperature and health checks built into it. We also run the Colorado iteration of a national shared services resource platform, chock full of templates, forms, savings tools for providers. The resource platform, it's free to all Colorado-based ECE folks for the rest of 2020. So I'll also make sure to include links on how to access this in the post-webinar messaging. Finally, before I turn it over and introduce our guest speakers, I do just want to introduce a couple housekeeping items. So first, that post-webinar messaging I keep mentioning, that'll be coming out about 1 hour after this webinar concludes. And that'll include a copy of today's slides, a presentation, a recording of the presentation, and then also links on how to access the resource platform. And then secondly, as I mentioned, but I saw that quite a few people weren't just on yet, our guest speakers will be having our audience members utilize their phones near the conclusion of the presentation. So please just have that on hand. Okay, time to introduce the guests. This is awesome. I had a wonderful time and wonderful opportunity, collaborating and data sharing with this team. They're all wonderfully nice, so I know you'll like them, and I hope you like it. So first, we have Dr. Dion Dobbins. She's 20 plus years of experience in project management and contracting in both public and private sectors. She's the head of the research department at Child Care Aware of America. So she's the big brains behind the operation. We also have Matthew Henry. He's the Chief Information Officer at Child Care Aware of America. So he leads the tech data research departments. And then also, last but not least, Christina Haney. She's the Senior Data Analyst at Child Care Aware of America. She's the one that put together, a lot of this report. So thank you all for being here, and I'm going to turn it over so that Christina is able to share. So thank you.
Welcome, everyone. Again, I'm Dion Dobbins, and I'll be talking in the beginning about giving you the context and a little bit of background about our report, and then I'll turn it over to Christina, who will share some of our findings. But again, as I mentioned, as Michael mentioned, we would love for you to participate in some poll questions at the end of our presentation. So if you can get your phones out and text CCAOA to 22333, and we'll be using, it's called Poll Everywhere. We'll be using the polling feature for that. And so if you do that, you'll be ready for when we get to that point. Next slide, please. And again, this is just us, me, Christina, and Matthew. Next slide, please. Great. So the name of our report, as you heard, was Picking Up the Pieces. And so one of the things people have asked us is why we titled the report that. Well, basically, we saw that COVID-19 devastated an already fragile system. And we feel like it's more important than ever to pick up the pieces of the childcare system. And while we're at it, build something that is sustainable and works for all families in the future. A little bit of background. Each year, Child Care Aware of America produces state fact sheets, and in the past, they've been price of care reports. We also do a number of one-off reports depending upon the issues that are being elevated in the child care space. The data that we use in our big annual reports, though, are gained through an annual survey of the states. And so the states complete this survey based on data from the previous year. So if we were going to do this as usual, we would only be reporting on 2019 data. Well, as you know, our lives changed dramatically beginning in March 2020 due to COVID-19. So we thought it would be a little bit tone deaf if we didn't speak to what has happened to the childcare system since the beginning of 2020. And therefore, we sought to gather as much information and updated data as possible from on the effects of COVID-19 on the childcare system. And one of the partners that we worked with was ELV. So we'll talk a little bit about that. So as you know, the impact of COVID-19 has further shattered a system that was already fragmented and unsustainable. So throughout this report, we provide our usual statistics with the 2019 data that I mentioned, but we also feature multiple case studies with updated 2020 data as much as possible. We also have what we're calling our Child Care Data Center, or the CCDC, in which we piloted with 6 states, and you'll hear a little bit more about that later. And then we have basically looked at trends over the past 5 months on 4 different areas: price or affordability, access or supply, enrollment, and quality. Also, we were pleased to have a couple of economists who were interested in childcare and interested in the space that we were in, and worked with us they looked at our data and gave us some feedback on what they think it means and where they thought the childcare space would go. If I can go to the next slide, please. So in addition to our usual report, which is usually a PDF and the appendices and our state fact sheets, this year we are pleased to present or feature an interactive website. Some of the features on the website include not just a place where you can pull down the full report, but we have a summary of the report online for folks who don't want to read a 40-page report, videos and interviews that we conducted with families and childcare providers that help us tell the story that we're trying to tell from different perspectives. We also have really cool infographics and tables and photos. Again, you can download the full report if you're interested in the appendices. And we have an interactive map where you can explore the data from each state. And I think later, Christina will probably take us through the website itself so you can get a sense of what's featured on it. You can go to the next slide, please. So as I mentioned, we organize a report into 3 main chapters, and that's kind of the way that Christina will talk about the data that we have, but they are access, affordability, and quality. So in addition to, as I mentioned, in addition to those 2019 figures, we feature updated supply data that we received from over 30 states. And we feature different aspects of how COVID-19 has impacted the childcare through our case studies. So go to the next slide, please. And finally, as a part of the release, as I mentioned, we're proud to share our new childcare data center, or the CCDC. And this was a project that was funded to collect information and childcare data at the program level for states. We piloted with 6 states: Illinois, Minnesota, Missouri, Oregon, Washington, and Wisconsin. And these states generously gave us provider level data so that we could create visualizations that tell us stories related to our 3 areas: access and affordability, as well as an environmental information, where this time we looked at lead exposure. In addition, 4 of these pilot states were able to provide updated data so that we could compare the childcare supply pre-COVID to the childcare supply in July 2020. So we invite you to look at the CCDC through our interactive website and learn more about the data. The nice thing also about it is that you can, there are opportunities to, take action and advocate for a better childcare system right on the website. So I'm going to turn it over to Christina.
Thank you so much, Dion. So now I'd like to take some time to talk about and walk you through some of our key findings in the report. So as Dion said, in 2019, the system, before COVID even hit, the system was already in trouble among childcare providers around the country. So we found in our typical 2019 survey that between 2018 and 2019, 79% of states reported a loss in the number of family childcare providers, and over half of states reported a loss in the number of center-based providers. And that's all before COVID hit. So in addition to our usual survey, we asked states to include numbers as of July 2020 for number of programs and also number of slots for both centers and family childcare providers. So we found that as of July 2020, 35% of childcare centers and 21% of family childcare programs remained closed nationwide. So half of the states that submitted data for July 2020 had lost more than 25% of their childcare capacity. We don't know if these closures will be permanent, and so I think it's, even though it's great to have this point in time, I think much more needs to be done to figure out the long-term damage to the system caused by COVID-19. So one key component of childcare supply that we don't collect through our survey is enrollment or attendance data. And we wanted to learn more about how COVID-19 had affected childcare attendance. So we partnered with several childcare data management systems to get these data. So they include Brightwheel, of course, Early Learning Ventures, or ELV, WonderSchool, and ProCare Solutions. So these childcare management systems provided different types of data to us, mostly around childcare attendance. And so starting with Brightwheel, they were able to provide regional attendance data. So they broke out their providers by the 4 census regions: Midwest, Northeast, South, and West. And we saw that, unsurprisingly, there was a massive decrease in March 2020 and also April. This is when COVID was really starting to hit providers, or the country, hard. And then the recovery of a lot of these providers started in around late May, early June. So as of mid-August, Brightwheel providers in the Northeast had recovered only about 50% of their pre-COVID attendance. And the South and West areas were about 60%, and providers in the Midwest had recovered about 70% of their pre-COVID attendance. So now I'd like to talk about the data that ELV provided. They were able to give us anonymized, de-identified data for their providers around the state of Colorado. And so we were able to break it down by provider type. And we looked at weekly attendance from January, before COVID hit, to July. As with Brightwheel, we saw, again, this huge decline in attendance, especially among center-based providers, starting in March and April. So while family childcare provider attendance among ELV users remained pretty consistent from January to July, we saw some huge variations in center-based care. And so as of July 31st, we found that ELV providers that used ELV in Colorado had recovered to about 30 children per week. So centers have not recovered quite as quickly as family childcare in terms of attendance. And so some of you might be aware that ProCare Solutions came out with a report in July that looked at attendance among its providers. So they were able to provide us with this data along with data from the month of August. So similar to our other findings, attendance has been slowly recovering starting around June. But among ProCare providers, its attendance is about 50% of what it was before COVID hit in March. So again, very similar trends to what we saw among the other data management systems that we looked at. So although these are only samples of providers based on whether or not they use these systems, we did see some pretty clear trends. Attendance and enrollment significantly declined beginning in March, and they're still recovering. And a lot of providers are only at about 50% of attendance of what they saw at the beginning of the year. So our next story was about affordability, or the cost of childcare. So based on our yearly survey, we do a national price estimate, and we found that, similar to last year, childcare, depending on age and provider types, cost anywhere from $9,200 to $9,600 per year. And if you want to know more about the methodologies we use to calculate these estimates, you can look in our appendices. And so for the mid-pandemic, so in July 2020, we anecdotally know that childcare costs have increased for a lot of providers due to things like needing more supplies, such as personal protective equipment, PPE, needing more cleaning supplies, and being able to accept fewer children because of ratio restrictions around states in order to keep children and providers safe. So we don't have data right now about how these increased costs are affecting the price of childcare. It's something that we definitely want to explore in the coming months as states update their childcare price data. But we do see that it could be some pretty devastating losses for providers. And then, so finally, we look at childcare quality. And based on our annual survey results for 2019, about 63% of centers and 52% of family childcare providers participated in QRIS, or Quality Rating Improvement Systems. And then we also look at accreditation. So on average, 9% of center-based programs and only about 2% of family childcares had a national accreditation. And we realize that the QRIS and accreditation can be limited in how they measure quality, and there could be other factors, but these are the ones that we measure when we're looking at quality in our survey. So just like with cost and affordability, we don't have up-to-date data on how the COVID-19 pandemic has affected providers who are higher quality. But we were able to present some case studies based on ELV data, and also we did a case study with Louise Stoney from Opportunities Exchange. She examined the costs to provide minimum licensing care versus the cost to provide high quality childcare for infants and toddlers, and then also for 4-year-olds. And so she found some pretty big, especially among infants and toddlers, she found that these providers, it was very expensive for them to provide high quality care. And so we can learn more about that from our report. And then I'd like to take some time to talk about closures among childcare providers by quality level. So again, we were very lucky to get data from ELV. And again, they provided that de-identified data for providers. And they were also able to give it to us by quality level. So we looked at average, they gave us average weekly attendance, but we kind of rolled it up to the monthly because it was the charts were getting a little hard to read. So we found that, we saw these big dips starting in March, just like we saw, everywhere else. Attendance went among level 5 providers, which is this gold line here. Starting in January, it was about 37 children per month. But as of July, it's only at about 22%. And so we saw like average attendance decrease by 40% among the highest QRIS rated providers that used ELV. But then when we looked at level 1 providers, we saw that the dip wasn't as profound as we saw with the higher QRIS rated providers. So average attendance had decreased by about 29%. We don't really know why higher quality providers haven't recovered as quickly, but I think it's something that we should continue to explore to see if quality providers are facing more barriers to recovering after the COVID-19 crisis subsides. So the key takeaways, based on the sample, we saw that attendance at higher quality providers were not recovering as quickly as with lower quality, or those that had lower QRIS ratings. And so we need more data from a larger sample of providers, and we need it from a bigger location. We can't just have it from one state. We'd like to have this kind of data nationwide so we can see if this trend holds throughout the country. So now I'd like to hand it over to Matthew Henry to talk more about data in general for childcare.
Thank you so much, Christina and Dion, and a big thank you to ELV, Michael and Milana. Thank you so much for the opportunity to spend time with you all today, and just can't thank you enough for this opportunity to provide ideas, provide data, provide systems level change that you all are making with the children and families that you serve through the work that you do. So just can't thank you enough for that. And with that, I wanted to just very quickly give some systems level or some strategic level ideas that we've been working on here at Child Care Aware of America. You've heard from my colleagues and seen from Picking Up the Pieces report the importance of data to enable change. As we know, data is fundamental to an equitable childcare system. What we've learned over 15 years of gathering, measuring, visualizing, and telling stories with data is that there's plenty of data. It's abundant and it's available. However, as Christina has mentioned just recently, it's extremely hard to get from all the states in a timely, standardized, systematic, and efficient manner. Data is scattered throughout the country in systems built by different vendors, owned by different entities, contained in various silos, and sometimes, sadly, out of reach. When data is available, it's a snapshot of a moment in time, and it quickly becomes outdated. And as we know, we cannot afford, especially in times of crisis like COVID-19, to be able to access data needed to impact lives. And as you can see on the slide here, we look at this data in what we call the child care data continuum. On the left, you have the transactional, that's the second by second data, everything from searching for child care, the transactions that happen at the child care program level, all the way over to the research, which we're presenting and showing you today when we can combine this into actionable data. This data continuum is tremendously important. Christina, if you could go to the next slide, please. At Child Care Aware of America, we've talked a lot about interoperability. Applying the lens of diversity, equity, and inclusion to interoperability, we borrow the word interoperability. And I know that's a mouthful, but interoperability is an approach that connects health and human services systems together to optimize outcomes. This ensures that decision-making is optimized to achieve goals for all families and communities. It also strives to customize the planning, design, and execution of work for unique needs and circumstances to include, again, all individuals, all families, and all communities. And it also acquires and organizes data so that it's accurate, that it accurately addresses the right people at the right time and in the right form. Christina, next slide, please. Our Picking Up the Pieces report and the gracious collaboration with organizations like ELV, we are exploring our dream, interoperability, as the foundation to this dream of interoptimability. When systems architects, data stewards, systems change agents, each of you on the phone today on this call webinar, work together towards interoperability, we see change. And some of these benefits we list here, and again, these aren't all the benefits, but some of the benefits that we are tracking in our dream of interoperability is we are enabled to enable a quality, equitable childcare system. We're able to inform childcare policy, research, and advocacy, and you'll see some of this on our interactive website. We would ask you to spend some time visiting, spend some time looking. There's specific actions that you can take today, as we all know, in this just important season of the election cycle. You can take some recommended action from the data that we've been able to gather and work together with ELV on. We can better serve local, state, and national agencies through combined data. There can be a source of truth regarding childcare data. We can have centers for external research and evaluation. And I think this next bullet point is probably one of the most impactful to me. We can link to broader societal impacts. We can have ROI, or social determinants of health, from childcare centers and knowledge of science-based quality and early learning. And some of you may have seen the Yale child care study regarding the pandemic that was released through our partnership with Yale a couple weeks ago. But this is the kind of broader societal impacts that this data and these collaborations will allow through interoperability. We can see national supply and demand mapping. This has been extremely important during the pandemic, and more so in a real-time nature, because essential workers has been at the very beginning of the pandemic were looking for childcare as childcare centers were closing. We are able to fund various mechanisms with technology through CCDF, PDF, and Head Start opportunities. And then we're able to interface to other interoperability work. An example of that is a project that's happening in the health sector called Project Unify. So just a really brief introduction to our dream of interoperability and interoptimability. And we look forward to continuing that with reports like this and relationships with ELV and relationships with each of you. And again, we thank you for this opportunity today. And with that, I'll turn it back over to my team. I know we have some critical interaction that we'd like to hear from you. We'd like to understand from your standpoint using our questions that we have keyed up in our Pull Everywhere technology. So with that, I'll turn it back over.
Okay, thanks, Matthew. And so, as Michael mentioned at the beginning of our webinar, we'd like to hear from you. And so we have this feature where you can answer questions via text. If you text CCAOA to 22333, then you can text responses. And so we'd love to hear from you. Our first question is, what systems are critical to connect together to continue together to improve the early learning experience for families? And so I don't know, Matthew, if you have like more clarification on this question, but is it more about data systems or?
Yes, and thank you, Dion. And as we're discussing this, please go ahead and text your answers here. We're just looking for those on the webinar today. What systems do you see or understand are critical to connect? I know many are working in various systems. I know we all work in various systems throughout a given day or a week. But what are the most important systems that you're seeing that are critical to connect together to improve this early learning experience for families? And I know it takes a while for people to text in.
Okay, great. So we have family engagement. The state systems need to revive data tracked at the child care level, policy, there's not consistent overlap between supply data and demand data. That's something that I definitely agree with that. Yeah, childcare search engine, CCMS provider systems, absolutely. Yeah. Safety.
Yeah, and Christine, that's an interesting one on safety. One of the stories that is on up on our CCDC. I think this is Lead Awareness Week. So just an FYI on that. We were able to use, analyze, harmonize that data, and have some some information there on lead. So would invite you to take the opportunity to look at that.
Yeah, and then yeah, connecting real demand to supply. I think we're definitely, I know that we're limited in what we use to try to measure demand for childcare. Yeah, unlicensed care, especially family, friend, neighbor. Yeah. And then linking early childhood councils and resource and referrals.
Yeah, that's especially an important one. I know in Colorado with the early childhood councils, very, very helpful information.
Great. Yeah, so these are all great responses. Thank you for answering this question. Oh, working closely with CCAP and licensing. Definitely.
Just to highlight to CCAOA, so CCAP, CCAP, that is childcare tuition subsidy for Colorado. So
Great.
yeah, subsidy systems need to talk, definitely.
Okay, yeah, and same messaging. Great. Okay. I think I'll move on to the next question. Again, thank you for these responses. So in your opinion, what are the barriers to data interoperability? Yeah, absolutely.
Good one.
Everyone's using different measuring sticks, turf.
And by the way, these are very helpful. We are using this input to continue to help modify our own work and the work with partners in collaboration. So thank you. Keep these coming in. This is very helpful.
Different standards to follow. Yeah, so many groups don't want to talk to each other.
Hey, Christina, there was a post in the chat on different opinions. It's very interesting.
Mm-hmm. Funding dictates.
So that one would indicate we need to have interoperability with our funders.
The outdated state systems that don't allow for any direct connections to provider data. Absolutely. Okay. Lack of common messaging across state systems.
You know, and Christina, while we watch these come in, just as an FYI, there's a national interoperability collaborative that we are participating in, and you know, anyone that has a particular idea, has a particular passion for this with us, would love to have you explore more. You can contact us, or you can go to the National Interoperability Collaborative website, which is we can get you that URL. But very would love to have continued thought partnership and action partnership on this interoperability question.
Incentivizing provider response. Yeah, I don't think this data would be possible without providers and you know, being able to share about their businesses and you know, what's going on. Data sharing issues. Yeah, we've definitely run into that as we try to work with various states.
And Christina, that's an interesting one on the incentivizing provider response. Very, very interesting, insightful.
Mm-hmm.
I do think that is another one that probably is, maybe a little Colorado specific. I'm sure you came across it quite a bit in your work as well. But, in Colorado, our state is pretty reliant on point in time data. So survey responses are sort of the lead, indicator of what's going on within our communities. So I think that incentivizing provider response might be tied to more of that point in time data rather than real time data. So interesting.
Yeah. Okay. Well, thanks again for taking the time to share your thoughts. And like Matthew said, we'll be, as we explore how to continue to drive this initiative nationwide, this type of feedback is really important. Okay. And so kind of to wrap up the presentation part, Dion's going to talk about future directions, and then I was going to take some time to talk through or just sort of walk everyone through the website.
Great. So, again, when you get a chance, go to our report and see the supporting documents. We have lots of policy recommendations and supporting documents. As I mentioned, the interactive website is really interesting. But what we want you to do, and Christina will show you how you can do this when she shows you the website, is really explore your state's information, use that information to share with others. So you can take action, you can amplify the findings from the release on social media. Gotten a lot of Twitter retweets and information that folks are sharing about what's happening in their state. And tell your network about picking up the pieces. And then finally, advocate. Follow the directions on the site, especially if you're going to the CCDC site. Tell Congress how to pass the child care relief package now. And we're saying that we need to include at least $50 billion to support childcare, and that is for really emergency funds and to deal with the pandemic now. But we also are very interested in pushing for sustainable, reliable, ongoing funding, because the pandemic is still happening. In fact, right now we know that there are spikes happening across the country. 50 billion is not going to last very long. We want 50 billion plus some sustainable funding. Much of the damage has already been done in some of these centers and family child care homes, where we are seeing, even if they're still open, they're still hanging on by very tight strings, and they're not sure they're going to be able to make it for very long. So just because they're open doesn't mean that they're doing well. And we also will be hopefully continuing to track attendance and enrollment, because again, that's going to affect whether or not they're able to make it. So really, the advocacy that we're seeking is really not just about the 50 billion, but ongoing relief. Next slide. I'll let Christina take over now.
And so Christina is going to take us through the website, the interactive report a little bit. It's really cool. So yeah, go for it.
Great. Thanks, Michael. And thank you, Dion, for outlining future directions. So on my screen now is, oh, sorry. Michael, can you see the Child Care Data Center? Okay, sorry.
Yep.
I just wanted to
disappeared
make sure.
for a second. You're back.
My
on
computer
your
went a little
screen
haywire. Okay, so yes, so as part of the interactive website, you will be led to a map of the states, and a blue state indicates that this is part of our pilot Child Care Data Center, and then gray states are states where we have some data based on the survey that we send out. And so I'll start by exploring a state. I'll just go with Colorado to kind of see what a non-CCDC state looks like. And so when you click on a state, you can kind of see like trends in like centers versus family childcare. You can also download a PDF of the state fact sheet that kind of gives a little bit more information about the price and any quality data that the state was able to provide. And that, like I said, these were states that, the gray states are the ones that did not participate in CCDC for the pilot. And now I'll just pick Washington. For the blue state, I'll show you what CCDC looks like. So as Dion said in toward the beginning of the webinar, we're telling various stories based on the provider level data that these states gave us. So we look at affordability, access, lead exposure, and for 4 of these 6 states, we were able to tell a story related to COVID-19. So affordability, within that, we look at, can families afford childcare? And you can look and see statewide. You can just kind of play around with it to see, various levels of income and various age groups and type of care. And so this is at the statewide level. And then we look at things like the nativity of parents, race, ethnicity of the householder, the median income of these groups. And we overlay that with the price of childcare to see how different family types are, how much they are kind of on the hook for childcare prices as a percentage of income. And then you can look again at, you can start playing around with this data by county. So you can, this map will change as you look at different, so you can look at center-based care for infants and toddlers. And if you hover over a county, it can tell you the average monthly price, and then how much of that is a percentage of median income based on median income for that county. And then again, in affordability, we look at, can families in poverty afford childcare? So we look at poverty, different poverty levels. So like families at maybe 175 of poverty, that for center-based care, you can see how much childcare would cost this family. And again, we look at different family types, and you can look at it by county as well. So we try to make it as interactive as possible, where you can, kind of play around with different scenarios and family types or family sizes and types of childcare, so that you can try to, again, tell a better story about what's going on in the state. So for access, we look at whether families have access to licensed childcare. So we look at the number of slots versus the number of children with all parents in the workforce in that state. And our developers were able to come up with this number of slots for every 100 children. And then we look at things like the program quality, and we also look at county as well. So again, you can hover over and you can see how many childcare slots for every 100 young children in that state, and it compares it to the overall state average. Our second sub-question in the access story is about having access to subsidized childcare. So we looked at the number of providers that offer subsidies or that accept childcare subsidies divided by all licensed providers. And so they were able to see out of every 100 providers how many accept subsidies. And you can look at that at the county level to see the supply of providers who accept subsidies within the state. And then finally, we look at, do families have access to non-standard hour care? So this is childcare that's offered, evenings, weekends, early mornings, outside of the 6 a.m. to 6 p.m. Monday through Friday typical workday. And so we were able to come up with 33 out of every 100 providers, so that provided this, either late night or early morning or weekend care. And again, you can see it at the county level, just to see the differences across the state when it comes to non-standard hour childcare. At the end of every story, there's a call to action. So if you want to you can include your information here, and it will help you find your representative and senator so that you can craft an email, to advocate for affordable, accessible, high quality childcare. Our lead exposure story, we looked at the location of childcare providers, and we kind of overlaid that with whether or not they were within 1 mile of toxic release inventory site, or whether they were in the same zip code as a Superfund site, to try to get an idea of statewide and at the county level, how many children, the maximum amount of children that could attend these childcare providers. And then we tried to give providers some ideas of what they can do to try to mitigate their risk for lead. Things like, covering bare soil with mulch, installing tap water filters. So instead of just saying this is a problem, we wanted to try to offer some solutions that weren't prohibitively expensive. And then finally in the lead story, we look at the children and where they're living rather than where they go to childcare. So we look at homes built before 1979, and we look at blood testing or blood lead level testing to see, if there's a higher percent of children tested and lower percentage of homes built before 1979 versus lower testing and higher older houses. And so these are kind of the counties that might benefit from a more targeted testing intervention. So this is we're just kind of laying the groundwork for lead exposure within childcare, and what childcare providers can do to help, and what states can do to help childcare providers. And then finally, with COVID-19, we were able to look at the census tract level to see, we compared the data that the states provided us in early 2020 to July 2020 to see the difference and how many providers were lost among via census tracts in that state. So you can look at by race, ethnicity, as well as number of providers or number of slots. And so basically the darker the color, the more slots or the more programs and slots that were lost. And again, we don't know if these are going to be permanent losses, but it just kind of gives a snapshot of where the supply is at amidst the COVID pandemic. And then we just have some very basic statewide comparisons of pre-pandemic versus mid-pandemic in terms of number of providers, number of slots, number of providers accepting subsidies, and the quality level of the QRIS level of providers, both pre-pandemic and mid-pandemic. So that was just a very quick walkthrough of what kind of data you'll find if you explore the CCDC, and as well as what kind of data is available for non-CCDC states. And so I think we were going to spend our final few minutes with any questions that you might have. You can put it in the chat, and we'd be happy to answer your questions.
Wonderful. Thank you so much. So yeah, so everybody attending, please feel free. Oh, I see somebody's already used the Q&A. Is the plan to have this capability in all states with your childcare data centers?
That is the ultimate plan. And one of the things that we're asking folks to do is, if there's a place on our website where you can, if you know that you are have access to state level data and are interested in talking with us about being part of the CCDC, we'd love to hear from you and talk with you about what it takes. So that is kind of where we're at right now, that we're kind of using the launch of our report along with the CCDC to get to build the interest in being part of the CCDC. So our ultimate goal is to have all 50 states, knowing that it will take us a while, but that we'd love to talk with folks who are interested in participating.
Wonderful. I actually have a question because I know you've been giving a variation of this talk to many different organizations over the past couple of weeks. Has there been any kind of like thing coming back to you that's a big aha about that you keep hearing consistently for states, or that one individual said that really clicked the light bulb for you?
For me, I've done a number of them. I think people are excited that we have some data, but knowing that we don't have all the data, and we also want to continue to track this information. Our report was released in September, and in order for it to be ready to go, the last data point we could get was July 2020. And so I think what people are hoping that we can do as an organization and with partners like yourself, continue to collect this information. And for us, we'd like to, have some shorter reports where we are giving more updates about what's happening across the country. And we're hoping that folks at the state level can help us do that. I think people are they're very excited about the fact that we were able to work with organizations like ELV to get more of the real-time data at the times and to see the trends over time, especially with the enrollment piece, because we know, like I mentioned, openings and closings are only part of the picture. It's openings and closings as well as like those who are open, what's happening with them. So those are kind of two things I've heard. I don't know if Matthew or Christina want to add.
Yeah, I definitely echo what you said about people being excited about us having data from organizations like ELV to really be able to see what's going on. Not just that this provider is open, but we can kind of get a glimpse of how they're doing in terms of attendance, which is going to affect, how much income they're bringing in and their ability to stay in business so that they can continue to provide that great care to children.
Yeah, and same here. We've heard many of the comments that came in during our question time with Poll Everywhere was let's work together. Let's get the state system, some of the common standards and so forth. So we continue to hear that message loud and clear.
Wonderful. All right. I do want to just give it one more minute in case anybody else has any other questions, but I don't really feel the need to keep us on here right up until 11. So yeah, I'll just let it, anybody have any last minute things they want to get out? As a reminder on our end, we will be sending out some post-webinar messaging that will include a recording of this presentation, slides over, all of these slides, contact information for our Child Care Aware team members, and also a little one-pager that Child Care Aware put together that helps to disseminate some of the information of the report for those stakeholders or politicians in your area that might not be able to dive into the full report, but need to see this kind of important information. All right. Well, thank you all so much for being with us here today. I'm going to go ahead and close out the webinar here in about 15 seconds. Again, Dion, Christina, Matthew, thank you so much for being with us here today. Thank you for all this work you're doing. Somebody has to pull together the data, and I know I get excited about data, but I know not too many other people do. So it's awesome to be connected with people like you that also get excited about it. So thank you all. Hope you have a great day, and we'll talk to you later.
Thank you.
Thank you.
Thanks so much.
Happy Halloween.